welcome everyone. I've got my signal that everything is ready online, so I want to welcome all our online guests in all time zones, and of course to those of you in the room, good morning. My name is Bruce Gordon. I'm the head of water sanitation and hygiene at the World Health Organization based in Geneva, and I'm just going to give you a little welcome on behalf of UNICEF and WHO to this session. So just in case you're wondering if you're in the right room, this session is about the joint monitoring programs efforts on safely managed drinking water. And just so we're on the same page, the report on the latest JMP report, the latest figures, trends, statistics was released earlier in July. So hopefully you've maybe had a chance to look at that. It did have a thematic focus on gender, and that is a session later today at 2 p.m. So hopefully you found that in your program. But this particular one is on water quality and water safety, safely managed services. And so that's a complex issue, and I think it's close to all of our hearts. It's something that has, in a way, has been the proxy for how the world looks at progress. So when now you'll see that we're not just 4 times off track, we're 6 times off track on safely managed drinking water services, and people tend to think about that as our overall kind of shortfall as we move to the SDGs. And of course, UNICEF is really engaged on this because of its impact on everyone, but particularly children. And for WHO, we released a burden of disease report earlier in the year, and there is still 1.4 million people dying every year because of poor wash. So it's a persistent problem. And the thing that excites me about this issue is the political response to the monitoring efforts that you'll see. So, in the previous MDG era, it was let's put in, kind of infrastructure. And now I think when governments see some of these results that challenge them to improve services, hopefully it elicits a response where we have to professionalize services, we have to put regulations in place, we have to do the whole ambit from financing to governance. So it's a very complex response to this. And in fact, one of the reasons I think that's great that you're here is, well, not only for you, this is a shared resource. The JMP is everyone's. So thanks for hopefully feeling a bit possessive about it. But it is complex. You look at the new report and you'll see a lot of probably challenges in terms of interpretation. And of course, it's challenged us to monitor. This is one of those things that brings us closer to the field. We have to train enumerators and people doing household surveys. And so it's been a real, I guess, enjoyable but challenging effort to try to get some of this more critical detail on water quality. So I think without further ado, I'd like to invite the team. You'll see them here. But first is Aisha. So you're welcome to come up.
So thanks, Bruce, for this great introduction. Today we will have these sections, but starting with the introduction, and then we will have a session on JMP estimates for safely managed drinking water services, in which I will try to explain the definitions a bit, and then we will follow up with the whole team here. Today you will see the whole team, a part of the main team, let's say. We will have Tom presenting integrating water quality testing into household surveys, and then we will have progress on safely managed drinking water services, where we'll dig the limiting factors by Rick. And we will have enough time, hopefully, for discussions, so please get prepared for that part. The important thing that I want to mention about these sections is we will have an interactive section in each of them. So please get prepared with your laptops, cell phones. We will try to do some exercise together. To start with, a brief history of JMP. Since 1990, JMP exists, and we've been doing a lot of work starting from the MDG time, a lot of work on the drinking water services. And it is important to mention that we will dig today more on the household setting, but we've been collecting data on households, schools, and healthcare facilities. While doing that, we publish these reports every even year for schools and healthcare facilities, while for households, we do we publish updates in odd years, and Bruce has just mentioned about it. The most recent one is just July 2023. And you can access the report by this QR code. When we talk about the proportion of population using safely managed drinking water services, which is an SDG indicator, 6.1.1, again, by Bruce, it was mentioned. It's a complex definition indeed. And we use various definitions altogether. To start with, I hope you can read them well, because they are little, but the base is having an improved drinking water source. And when I say improved drinking water source, it is like by nature, safe water is provided to households, meaning it could be piped. If it's non-piped, you know, it's a protected well or dug well. So for the first 3 layers we have here, safely managed, basic, and limited, we need the improved water source by default. On top, the other additional dimensions are accessibility, availability, and quality, which are the human rights criteria. So this Venn diagram, I think, is explaining it in a better way, because the intersection of accessibility, availability, and quality brings us to the safely managed drinking water. And as it stands, we call it drinking water from an improved source that is accessible on premises, available when needed, and free from fecal and prior to chemical contamination. When it comes to data sources for this indicator, we compile various types of data, starting with census and household level data. It also, especially the quality data, comes from administrative data, and we also have secondary data sets compiled by international organizations and regional initiatives. And we have the security alert, I think, if you see it or not. Oh, good. I see it on my screen. What we do is, there are additional studies conducted by research institutes, technical information received during country consultations, which I want to mention about, because what we do is we compile as a team the data available. We insert them in our country files, which we will see in the following exercises. Then we send back these country files to the countries, regional offices, our regional offices, and validate those through them. And at that stage, we receive even additional data. This is covering that last point, basically. But if we see these results, these graphs are all from our most recent update, as I mentioned. And if we see the distribution of the data availability coming from different data sources, you can see that around 4,000, we had data sources for drinking water in 2023, and almost half of them are from the household surveys and censuses. The last figure at the bottom is actually showing the specific distribution, the change in time for safely managed drinking water, and I can tell you that the dots are for the proportional population which had the data, and the bars are for the numbers of the countries. And you can see 143 countries in 2023, we had data for safely managed drinking water, while it was 95 in 2017. So we have a great increase, half by half, I can say, and it's consistent in rural and urban settings as well. But when you dig, the colors of the bar charts here are showing the income levels, basically. Different groups of countries having different processes, definitely. I mentioned about the importance of household surveys and censuses. So for those, we have standardized questions, and we publish them in this main document. Here is the core questions on water, sanitation, and hygiene for household surveys. We list the questions which are, feeding into these analyses, basically, in this document. But another important document here, or resource, I should say, is the methodology document, where we explain how we put those numbers together for calculating safely managed drinking water. Multiple indicator cluster surveys, which are conducted by UNICEF, led by UNICEF, is one of the main sources we use for, under the umbrella of household surveys. And Mix 7, which was just recently landed, let's say, has these questions for water section, where we ask the main drinking water source, the type of those one by one listed as options, so that we can understand if it's an improved source or not. And then we have the following questions on the location or time to reach the drinking water source. And last is the sufficiency of the available water, which are all blending to our indicators, safe and managed drinking water. Again, you can use these QR codes to reach those tool packages, because Mix 7 has a great web page, I should say, listing all these, questionnaires, the survey tools, guidelines. So please try to visit that page. Another section in these surveys is the quality control part, which we will dig more through Tom's presentation, so I'm not going to explain too much, but we also have in the Mix tool package, relevant documents. Again, with this QR code, you can reach them. I want to start with this interactive exercise. I hope you will be all interested. What we want to do in this part is to show you how our country files are working, or how they are structured. And if you can, with your mobile phones, or for the online audience, actually, it will be much more easier using the website link here. We would like you to go to that webpage just to see first this screenshot here. We have this download list of items page, and where you see the region names one by one, and you see there in columns households, schools, and healthcare facilities. As I mentioned, we collect data on drinking water from different settings, but we will focus on the household part today. So for an exercise, we picked Brazil to show you some, details about that country file. So if you can go to Latin American region and try to find Brazil file there, you can see in household column, we have country file inequalities. Please go to the country file one. Yes, country file Brazil. If you can open that, and we will dig more, but I want to give some minutes. In the room, I think you all use the code, or should I wait? If you are asking a question, households, yes, household column. Don't forget about the schools and healthcare facilities. I know we have lots of information, but we will concentrate on the households today. So if you can, households and country file, Brazil. We have some little questions that we will ask soon. I mean, when you open the file, you should see the introduction tab, where you see this kind of this is what you need to see, actually. And you can change even the language in that file if there are speakers here of different languages. We have all UN languages except Chinese. No, Chinese is also included, actually, but partly. Sure, the code is back again. 1-2 minutes more just for everybody to open that file. And maybe if you opened it already, you can just try to see the different tabs in the file. Mobile phone, it could be difficult, but if you have laptops, it's preferable, definitely, because it's a big file. So our questions are here. Like, it's, again, the code is available in this slide. You can use that. First, to start with, in the Brazil file, we would like to ask you if you can tell us how many data sources are listed in the country file. I know most of you haven't even opened that file before, but this is the part of the exercise to see how difficult, how complicated the things we put together. This is a great opportunity for us to get feedback from you as well. So we want to start with this first question, and then we will ask if, when you figure that out in the country file, how many data sources are available, we want to ask also, we want to see if you can find the most recent data source for the water quality data. And the last question will be the proportion of the population which has access, who has access to safe and managed drinking water services. This is the last one. I want to give a couple of minutes to you, and then I'll take this stage again back and try to show you how. But yeah, I think that's safer for you to first try a bit. Oh, we are receiving already some responses online as well. That's great. And correct answers, actually. That's great.
Even better.
Yes. Thanks for the online audience, really. Please keep on posting, because we are following them up. I mean, I'm here, yes, I'm talking, and I'm not doing multitasking that well, maybe, but Ricky's helping me. So shall I start? I think it's quiet, it means good, because people are really looking at their phones and screens. So for the first question, and actually for most of them, I mean all of them, not most, we have multiple answers. I mean, there's no one single way to figure out these information. So if you're getting confused, I think you're on the good way, because there's not one single way. To start with, for the list of data sources, you can use several tabs again. But to start with, I think when you open a country file, data summary tab is a great one, where you can see various details about the whole country file in one go, basically. So this is the screenshot. I was willing to try it online as well, but I'm not risking it. I'm going to use the slides. So in this tab, you see this view where on the top you have some buttons like drinking water, hygiene, sanitation, and menstrual hygiene. These are just shortcuts to different sections, but since we are dealing with now safe and managed, we stay in this place. And on column A, you see short names and data source short names and years for the specific country. It is starting from Brazil, BRA 1986 DHS, and goes down up to CISAGUA 2022. So if you count the number of rows there, you will see there are 78 data sources. And we see here Rafaela Betts, applauses from online. they gave, I'm sure you know as well, but unfortunately I can just see that response. So here again, in the first column you see the data source name, short name, and you see in the second column the type of data, if it is a survey, because we have, as I explained, various data sources, but also type of data we receive is can change. For instance, we try to give the priority to surveys with microdata. We take the microdata, we put the numbers together to be sure about the definitions and the methodologies consistent. So you can see here, for instance, for some data sources, we have that detail, micro survey with microdata. If you go away from those first columns, you see the first D column, starting with D column, we have the information on drinking water. And we have always national or total, we are changing that definition as well, total numbers, urban numbers, and rural numbers for each set of columns. And you see the segregated data. If it is improved, is how many percent, piped is how many percent, kind of those details. I will move ahead with the second question, which was asking the most recent data, water quality data coming from which source, right? So for that, actually, we are using this segregation part. In the column J, you see free from contamination definition, right? So this is our water quality relevant data column for national data. And if you go down, you see rural-urban data is available for Sisagwa at the last column, which I tried to mark it in red, available. So I want to explain one more detail here. We use first urban and rural data, if it is available. We put together those estimates as national estimates by using population data. So we give the priority to those segregated data. And you see here, that's why these two available. And in brackets, there are some brackets, maybe some of you are questioning them. It means that we are not using them for our estimates. They are available in our country files, but we give, for instance, it's a good example, I think, row 75, as far as I see. 74, where we have the urban and rural data. We put together the national data. That's why it is in brackets. It's a small detail, but it's good to mention, I guess. As I mentioned, there is no one single way, and maybe some of you are questioning, okay, these are short names. How do I know the exact name of the data source? For that, you need to go to the Water Data tab, where you have all even more detailed data available for the water section. In column A, again, you see the short names, but if you click those links, you go to the relevant data source, like we see here in one block, you see here. You see coming all those, as I said, the segregated data available line by line, more and more detailed in these blocks, basically. And again, we see the count here, or the most recent data available in a difficult way this time. Water quality, you need to check by one data sources, so it's not the ideal way. But yeah, this is another source. The last question was on the proportion of population who has access to safe and managed drinking water services. For any country data, to have an overall view of the JMP estimates for different letters, you can use this letters tab, and this question's answer is already embedded here. This figure, first one, where we have stack bars. By the way, JMP is so into we have standardized figures we always promote, and we have our colors always promoted. In the blue section, you can always understand it's water relevant. And again, here, national one, you see that it is 87% of the population had access to safe and managed drinking water services in 2022. In our 2023 report, we published data up to 2022. Another way to see it, again, there are various ways, but you can go to the estimates tabs, where you see the details this time of our estimates, and you can also have the desegregation by rural, urban for all years, not only for 2022, but earlier years as well. And again, the last one, I hope, is the charts data. If you don't want to dig line by line, the numbers, try to trace what's going on, charts SM, Safely Managed, gives you a quick summary of how things moved in time. You see the charts here. For again, we always publish total rural urban to see the differences better. And there's also another table there, data table there, where you can catch the number for safely managed drinking water estimates. I think I will leave the floor. If you have questions, please keep them at the end. But I will invite now Tom to dig more a bit on the water quality part. Thank you.
Okay, thanks, Ayça. So moving on, we're going to talk about where some of these data are coming from, and in particular, the efforts that have been made since the beginning of the SDG period to integrate water quality testing into household surveys. So what are we really measuring here? When we say free from contamination, we find that people are very familiar with the global headline statistics. If we say 74% or 3/4 of the world's population are drinking water free from contamination, what does that really mean? Well, it's partly about fecal contamination, and it's also about priority chemicals. So those are the two things that we're most interested in. And when we talk about fecal contamination, we're talking about fecal pathogens, and for that we're using the WHO recommended fecal bacteria indicator, which is E. coli. So this is something which is recommended for all countries. from high income to low income. It's a problem in every setting. And ideally, we want to be testing not only at the point of collection or the point of delivery, but also at the point of use or the point of consumption. Many countries have data on the point of delivery. Very few have it on the point of consumption. And we're also interested to try and calculate risk levels. So we want to quantify the risk of fecal contamination. And we do that by counting the number of colony-forming units in a 100 milliliter sample. This is the standard sample that is used. And we can then use that to classify, and you can see at the bottom here, into risk categories. So when we say free from contamination, what we actually mean is low risk, less than 1 unit per 100 milliliter sample. If there's between 1 and 10, then that's medium. 11 to 100 is high, and over 100 is very high risk. So these slides at the bottom here are showing you examples of plates from water quality testing where you're able to count the number of colony-forming units in a 100 milliliter sample. Similarly, for the high priority chemicals, we're most interested here in fluoride and arsenic. There are many others that are measured and monitored at a national level, but globally, for the purposes of global monitoring, we're interested in fluoride and arsenic. So where these are recognized as a risk, they should be measured and monitored at the national level, and we compile those in our global database, and we use them for the calculation of safely managed drinking water. Here we apply standard WHO guideline values for both arsenic and fluoride. So when we say free from contamination, we mean the proportion of the population that is using sources which are compliant with WHO guideline values. Now, what do we have at the moment in the global database? So for the last report, you can see that we had data on fecal contamination. So this is primarily E. coli, ideally E. coli, but we will also use data on thermotolerant coliforms if available, for 172 countries, areas, and territories. So we have 234 countries, areas, and territories in our global database. 172 have at least some data on fecal contamination, which is great. That's a really big improvement since the beginning of the SDG period, as Aicha mentioned. The data are primarily coming from administrative sources, but also from household surveys. They're mostly, as I mentioned, about the quality of water at the point of collection or point of delivery, rather than at the point of consumption. So for the global monitoring, we're using data on the point of collection, because that is currently most widely available. It is also the point at which governments and service providers are usually held accountable for the quality of water delivered. We have much less data on arsenic, so 77 countries, and fluoride, 73 countries in our last report. And where we have data on all of these elements, the way we deal with that is that we take the minimum value. So we take the minimum for fecal and for arsenic and for fluoride, for the urban population, for the rural population, and for the total population. And we had about 64 countries with all three parameters in the last report. And in the vast majority, E. coli is the limiting factor, so 75%. There are some countries where arsenic is a limiting factor. There are 7 countries there, or where fluoride is the limiting factor. These tend to be the higher income countries where there are significant problems with chemical contamination. And of course, there are still a very large number of other parameters which are measured and monitored at the national level, which are highly relevant, but they're not currently part of the framework that we use for global monitoring, which is used to calculate the estimates in our last report. Important to say here, there are some examples like Bangladesh, for example, where although you have very high levels of arsenic contamination, it is still lower than the levels of fecal contamination, and so it's the fecal contamination which is driving the estimates. So one of the things that we've been supporting since the beginning of the SDG period is water quality testing in household surveys. This offers the opportunity to collect samples at both the point of collection and also the point of use. And here we're using those samples to quantify the risk of fecal contamination in a 100 milliliter sample. This is a test that takes about 5 to 10 minutes to conduct. And then we are incubating the samples for a 24-hour period reading the results, and then recording those as part of a survey report, which is including a lot more information on those households. So it enables us to do a lot of additional analysis of the relationship between drinking water quality and the socioeconomic conditions of the households. We typically are taking a subsample of around 3 to 5 households per cluster. We find that this is generally sufficient to capture the variability. This is largely because within a given community, many people are using the same drinking water sources. This is a test that can be done with some training by an existing member of a household survey team. It's usually somebody who is also doing other measurements, such as anthropometry, and we give very detailed protocols on how to do these tests. And there are also a number of sort of quality assurance, quality control measures that have been put in place. There's an in-depth training that's done with the enumerators before the survey begins. We have blank tests to pick up whether or not the enumerators are introducing any contamination. And we also have a lot of field supervision to flag any problems early on so that it doesn't affect the quality of the data. The kit that we're using is relatively compact and relatively low cost. We're doing a standard sort of membrane filtration, and the filtration stand that you see here is very similar to the types of stands that you'd find in a standard laboratory. We're filtering a 100 milliliter sample onto a membrane. We're then adding that membrane to a compact dry plate, which has a growth media, which has a specific enzyme in it, which means that it will turn blue in the presence of E. coli. And that is how we can then measure and count the number of colonies. And we incubate these plates in a number of different ways. We recommend using a simple, low-cost incubation belt, which means that field teams can incubate the plates even in remote rural areas where there's no electricity. But in some surveys, they can also be incubated using a standard sort of electric incubator. So the filtration stand is the most expensive part of the kit. It's around $1,500. You have all the different consumables. It works out at around $2 to $3 US per test. And we're also working at the moment on reducing those costs by introducing a lower cost filtration stand, which we hope to be able to use in future years. So it's proved highly cost effective. We estimate on average it's around $50,000 to $75,000 in addition to the main costs of running a household survey. So it's very appealing to national authorities. It means by piggybacking on an existing survey, it's much cheaper than running a dedicated survey on drinking water quality. And of course, we get a lot more information back on the socioeconomic conditions of those households. We're able to procure these equipment from UNICEF's supply division, and those can be distributed quite quickly to different parts of the world. And there are a number of materials that can also be procured locally. But you'll find on the website a number of tools. There's a manual for water quality testing. There's the forms that are used to record the results, training materials, etc. We also have a pool of international consultants who are available to support the training of enumerators. And we also have sort of standardized approaches to analyzing the data, syntax, scripts for analyzing the data for the survey reports. So all of that is on the website. It was developed for Mix 6, and it's now being updated for Mix 7. And so since the initial early pilots in 2012 in Bangladesh and Ghana, and then the sort of standardization of the module and the scaling up of this activity during the SDG period, we've now supported over 50 countries. It was developed by the UNICEF Multi-Indicator Cluster Survey team, but it's also been adapted and applied in other surveys, such as DHS surveys, World Bank LSMS surveys, and a growing number of national household surveys. We have the guidance. We also have a synthesis report, which is capturing the lessons learned to date. And there's also a lot more surveys in the pipeline. So you will see there's a bit of a drop-off during COVID, particularly in 2021 and 2022. There are a lot of surveys that were put on hold, but are now being completed and written up. And there are a lot more which will be happening towards the end of this year and next year. So a lot of work that has been done, a lot of countries which have been supported to establish baselines that they didn't previously have. Of course, the challenge now is to be able to collect additional data to allow us to track trends over time and to further analyze inequalities. But we're going to do another short interactive exercise now. Again, this is just to help you understand how the data are being captured and presented on the website, and how you can access and use those quickly to get the information that you need. So you can see here the link, the QR code, which is taking you to the section of the website with the data on WASH in households. We're going to use the example of Brazil again. So hopefully you're already there, and you're already looking at Latin America and the Caribbean. So here are a couple of questions for you to look at. We want to know what rank does Brazil hold amongst the Latin American and Caribbean countries for accessibility of drinking water on premises. So to do this, you would want to access the website and the data tool and try to create a rank chart for the region of the proportion of people with drinking water. And you can do this by accessibility, availability, and quality for any given year. But in this case, we're interested in 2022. And then the second question, using the data tool, is, has water quality in Brazil improved more rapidly in urban or in rural areas? And for this one, we'd like you to try and create a bar chart showing water quality at the start of the SDG period in 2015 and for the most recent year, which is 2022. Now, for those of you on laptops, it'll be easier than for those of you on phones, but I'm going to give you a couple of minutes, and then we'll see how you got on. So all of these exercises are designed to just help people understand what we currently have on the website. But at the end of the session, we also want your feedback on how you're using these data and what other data you would like to have, or what other formats you would like to have the data in order to be able to use it for your work. So how are we getting on, Rick? Any answers coming in online?
No answers online yet.
Ah,
You could be the first.
the race is on.
No question.
So if you didn't get the code, here is the link, and here is a QR code which will take you there. So I've just been informed that somebody has already got the correct answer. I think it's Kamar Iqbal has correctly identified the rank that Brazil holds. Is it 7th, Rick, for accessibility of drinking water on premises?
Within LAC.
Within LAC. Any progress on that second question?
Not yet.
The JMP website is quite powerful, but it's also quite basic. And we will be updating it later this year or next year. So this is a good opportunity to have a look and let us know how we can improve these data tools, make them more useful. Anyone to have a go at this second question? You could do this through the data tool. You could also do it through the country file, which I just showed you earlier. But that would be cheating.
But you may have downloaded already.
Or by guessing. The JMP does not recommend guessing. Would you like more time? Or would you like me to talk you through how to do it? Yeah? Still working on it? It is difficult on the phone. It is, yeah. But we also have a lot of people online on laptops. Any answers, Rick?
Yes. Is Rafaela disqualified because they won the first round, do you think?
We have some star performers in both rounds. Okay, so Rafaela has got it correct. Rural has improved more rapidly than urban. Okay, so let's have a quick look at how you can do this on the data tool. So if you go to the top, you can select the geography, you can choose your region. There's a drop-down menu, and there are a range of different regional groupings that you can choose. But in this case, we were looking at the SDG region of Latin America and the Caribbean. And then you can create a number of different charts. So you have a button here that says Create New Chart. And you can select the type of chart you would like to create. Another way to do it would be to select one of the ready-made charts that you have below and to edit that chart, to change it, to look at different variables. Two different ways to do the same thing. So if you do that and you select a rank chart and you select the correct geography, you're ranking countries within the SDG region of Latin America and the Caribbean. And you're looking at the change in coverage rather than in population. And in this case, you're looking at total, but you could also select rural or urban, and in some cases you can select wealth quintiles. And then you have a choice whether you want to select the service levels of the JMP ladder, you want to select piped, non-piped, or you want to select the criteria of safely managed drinking water. And here we asked about accessibility. So if you select accessibility and you select the year 2022, you can look at all of the countries in Latin America and the Caribbean, or you can just select the top 10 or the bottom 10. And here, if we look at all of them, you can see that Brazil appears here, number 7. Actually, there are a number of countries here which have 100% accessibility, and that is because it's rounded up to 100% on the website. But I think the actual number is more like 99.59 or something like that, which is why it is 7th and lower than the others, which are truly 100%. And then if you want to compare progress in rural and in urban, this is a ladder chart, a bar chart. Here you adopt the same approach, select your geography, and then select your country, which is Brazil. You are choosing to look at coverage of drinking water, and you're selecting rural and urban. And here, if you click on quality, you can decide how many years you want to display. In this case, we selected 2 years, which were 2015, the beginning of the SDG period, and 2022, the end of the period. And here you can see a bigger jump in rural than in urban. What this doesn't show you is the change in population in rural and urban in Brazil over that period. So if you were to analyze by population, you would see something very different. Both of those are available on the website. But the correct answer to the question is that coverage in rural has increased faster than coverage in urban. Okay. Thank you very much. I'm now going to pass over to Rick, who's going to give an overview of progress on safely managed drinking water.
Thanks, Tom, and thanks also to our online participants who are doing really well in getting the correct answer to our little quizzes. Astonishingly, we are not behind time, so I'm actually going to nip into our website and replicate a little bit what Tom just mentioned, just so in case you're working on a phone and you couldn't do it on the phone, you see what it's like. So this is our data portal here, and if we would go to the households section, you would just see, as Tom showed, there would be these default charts. The aspect is really strange on this screen, but you can change your geography here. Why not go again to the region and the SDG region of Latin America and the Caribbean? And again, so you see on the map, the region is highlighted. Now we could either create a new chart or we could edit one of these existing charts. If we look at some of the default charts for drinking water and edit that rank chart, then you'll see something similar to what Tom was showing, except this is showing the full ladders, or this is showing the basic and safely managed rungs on ladders. Now it's interactive, so we could add other rungs if we wanted. We could see all of the ladder rungs together. But what we were asking for was to look at the safely managed criteria one by one. And we were selecting the one for accessibility. So there you go, and you'll see again that Brazil is indeed number 7 at 99.59%. This pro tip here, if you click on this little label item icon, you'll be able to see the percentage on the graph. Now the second graph that Tom referenced was also one of the default graphs here. Let's go to a country level this time. We'll go straight to Brazil. You can just start typing in the letters and it will take you not to Gibraltar but to Brazil. And if we edit it to optimize this one, you see it starts by showing us all of the service levels, but we can switch back to the safely managed criteria and look at quality. Here again, we're looking at urban and rural. We'll put on the tag so you can see the numbers again and see, yes, rural increased from 63 to 76%, while urban increased from 85 to 89%. But now let's take a look at the population number and see how that has changed. Well, now we see that in rural areas, about 2 million additional people gained access to quality drinking water, free from contamination, in rural areas. But in urban areas, because of population growth, it was about 17, almost 18 million people who gained access to water supplies free from contamination. So it's really important to be able to consider both proportions of population and the actual raw numbers of people. And you can do both of them on the website, and we try to show both of them to different degrees in our reports. So,
can I just ask, can you apply multiple safely managed criteria, or is it one, is it exclusive? Like, can you apply all three to see?
All three together?
To see, like, or is it?
No, you can do them one by one, but I'm actually going to talk about the intersection and how those three get combined in the next presentation. But if you would look at like accessibility on premises, for instance, you would see kind of similar stories. Let me turn then to the report. Yes. Okay, so in July, we came out with our most recent report, special focus on gender. Please come to our session this afternoon at 2 o'clock and hear about that. But to highlight some of the data on safely managed drinking water, we had 142 countries, areas, or territories with enough data to make estimates for safely managed drinking water services in 2022. And that represents just over half of the global population. And we could also make estimates for 6 of the 8 SDG regions. You can see from the map, unfortunately, we're still lacking data from India and China. You know, it's hard to make global estimates without those 2 countries. We actually have data from rural India and from urban China. So we're hoping that in future years, those data gaps can be filled. Let's see. On the next slide, you can see the rates of progress in the different SDG regions. Each region, many regions have one large country that's kind of like the anchor, and if we don't have data from that country, it can be difficult. Actually, in Eastern and Southeastern Asia, there are other large countries, so we're still able to make estimates even without India, even without China. But Papua New Guinea in Oceania doesn't have data yet, so that's just not going to be possible until data are available from Papua New Guinea. And unfortunately, Australia has data at the province level, but not collected at the national level, and also not collected for rural populations. So we have a data gap for Australia. But still, if you look at the progress going from 69% to 73%, you know, that's on track to reach something like 77% in 2030, not 100%. So that means the rate of acceleration would need to be 6 times higher, as Bruce mentioned in his opening. And even for basic drinking water, we would need to see the rate of progress double to get to universal basic water by 2030. So definitely room for, well, a need for acceleration. Now, there are these 3 different parameters that go into safely managed drinking water. Actually, there's 4. First is having access to and using an improved water supply. But then that water supply should be accessible on premises, it should be available when needed, and it should be free from contamination. And these 3 figures show that that is not always the case for people who have improved water sources. The first one shows improved water sources on the x-axis, and then how many of them are actually located on premises on the y-chart, on the y-axis. The second one does the same for is water actually available when needed. You can see Venezuela, for instance, has nearly universal use of improved water supplies, but very often water is not available when needed. The third one, about water quality, you can see quite a lot of countries far off to the right. They have very high coverage with improved water supplies, but many of them are contaminated with fecal material. So they don't meet the criteria for safely managed drinking water. Now, these data sources often come from, well, these data points often come from different sources. They might be household surveys, they might be administrative data, and usually we don't have the 3 bits of information from the same households. So we can't integrate them at the household level and say how many households meet all 3 of these criteria. So what we do instead is we integrate them to the urban and rural level, or sometimes the national level, and say, well, which of those 3 is the lowest? And that we take as the limiting factor, because we know safely managed can't be higher than the lowest of those 3 factors. And it turns out if we do this, we see that water quality is most commonly the limiting factor. So where we do have data on all 3 of these things, it's more common that water quality is going to be lower than accessibility on premises or availability when needed. But there are some interesting spreads. So one thing you can see from the graph on the left here, which shows the number of countries with estimates, is there are a lot of countries that have estimates at the national or total level, but don't have urban and rural disaggregation. Okay, I think there are 142 national, but only 75 rural and 96 urban estimates. Okay. If you look at the right, the proportion of estimates by limiting factor, about half of cases, it's water quality that is the limiting factor. But if you look at accessibility on premises, that's the second lightest blue, that's the second most common consideration in about 1/4 of cases. And particularly in rural areas, over a third of countries have this as the lowest factor. Now, availability when needed is less common as a limiting factor, only 13% of all countries. but especially in urban areas, you can see almost a quarter of urban areas find this as the limiting factor. And of course, if you're trying to improve services and reach safely managed, you'll have different approaches based on which of these three parameters is representing the biggest challenge. Let's look at each of the three parameters and show some country examples for rural and for urban areas. First, accessibility on premises. You can see there are 27 rural and 19 urban countries, where these are the limiting factors. On the left side, in rural areas, you can see that there's often a big gap between having an improved water supply accessible on premises and having one that's available when needed or free from contamination, or just having an improved water source at all. Uganda is interesting because in both rural and urban areas, coverage is much higher with improved, with available when needed, with accessible on premises, but accessible on premises is the big challenge. And you can see in a lot of sub-Saharan African countries in rural areas, this is the biggest challenge. There are fewer countries where having water available when needed is the limiting factor. That's shown in triangles here. So there's a couple, though. There's 5 countries where in rural areas this was the limiting factor, and 23 in urban settings. And these are different kinds of countries. So in rural areas, Algeria has this issue. But there are a lot more urban areas, and these tend to be more middle income, emerging economies types of countries where coverage with improved water is very high. Maybe it's universal. Maybe it's piped water, but it's not continuous piped water. It's intermittent. They're still facing challenges with getting water available when needed. Different problems, different solutions and approaches. And then lastly, freedom from contamination is the one that affects most countries, and you'll see both in rural and in urban areas, often there are, again, big gaps between having improved water that's available when needed, accessible on premises, and then way off to the left, you see that it's actually free from contamination as well. Lao PDR is interesting here because, especially in urban areas, I mean, if it weren't for water quality, Lao PDR would have near universal, safely managed drinking water services. It's water quality that's the challenge in these countries and settings. Sorry, I've just got little windows popped up here. Give me a minute. Okay, great. So that's the end of the data presentation. I just want to conclude with some ideas here reflections really that come from the report, is that we do see national systems strengthening with regard to monitoring of safely managed drinking water. You saw Aicha show the number of countries that had estimates is steadily improving. We are seeing more and more countries integrating these global indicators into national monitoring systems. But there are still big data gaps. Water quality is a particularly big data gap. Some of these data might come from household surveys, but those are infrequent, maybe every 3 to 5 years. It takes a long time to get results published. And administrative data would be a more ideal source to have, but often those are incomplete and don't cover rural areas or non-pipe supplies or private systems. We see big differences in data quality between and also within countries where not always the same definitions are being used. Data collection methods can be different, so it can be difficult sometimes to compare data from one source to another. But we do see a tendency to move more from monitoring individual projects or programs even to national monitoring systems aligned with the SDG framework. And then if we think about accelerating progress, well, again, thinking about these limiting factors, quality is super important. It's often, but it's not always, the biggest challenge being faced. And especially in rural, especially in sub-Saharan African countries, having that water, that improved water accessible on premises remains a very large challenge. And then availability, I think, is maybe an unrecognized challenge that's part of the SDG indicator, especially in urban areas, especially in middle-income countries. So I just want people to remember that safely managed drinking water, it's more than just quality. It encompasses a lot of different aspects of drinking water services that draw on a human rights framework, and we might need adapted approaches to accelerate progress in different settings based on that. With that, I think we have time for some discussion and comments. Could be either about this general approach or the limiting factors discussion, or we'd be happy to hear anything about the website, the country files, how easy or how difficult you find it to access and use the data that we're trying to make available. So, thank you. And Tom, I think, is going to facilitate a round of questions.
Okay, good. So we have managed to get through our presentations and our exercises in pretty good time. So we've got plenty of time for discussion. We wanted to make this interactive. You can ask us anything, but maybe we could sort of group them, questions, into sort of questions about concepts, understanding the method, any sort of questions that you have based on the presentations. And then maybe others to do with, how the data are presented, things that you would like to have that you can't currently get from the JMP reports or the JMP website. But really, anything else, feel free. So if you can raise your hand, then maybe we could get a roving mic to go around and pick up the questions. Thank you. And maybe you could start at the back. Gentleman at the back was first, I think. And then we'll just try and work our way forward, if that's okay. And Archer and Rick, do you want to come up, and then you can answer questions from the mics?
Thank you very much. My question goes to the very last presentation. Very intriguing, I must say. On your slide number 30, you were talking about China and India, and basically saying that you didn't get enough data from those two countries. And it was playing in my mind as to why would that be? Is it because of the size of the countries? What is it about, really? I just wanted to understand what the challenges were, because I think that those two countries, like you rightly said, are a critical mass, and the more we know about what's going on there, the more we can extrapolate and learn and draw lessons. So what are the challenges, with these big countries? Why couldn't we? Yeah, it says there are insufficient data, and I was very curious as to why. Thank you.
Okay, very good. We're going to take a few questions and group them, and then we'll try to answer. So let's keep working our way along the back row, if we could. And then if you go to the other back row, there's a gentleman with his hand up over there. Thank you. Yeah. And please tell us your name and your organization.
My name is Jose. I'm from the University of Oxford and from Segura, water quality monitoring startup. And my question is on the willingness and ability of the JMP to adopt innovation. As you were mentioning, the platform itself is changing. And I see a lot of opportunity to integrate a lot of other technologies, like remote sensing, a lot of other things that could be very innovative, but I don't know how able and how quick could something like this be, knowing that UNICEF and just bigger organizations take time and have different incentives than smaller SMEs to kind of actually adopt different solutions, especially thinking 2030 and the 7 years you have budget.
Okay, thank you very much. And there's another hand up on the back row on the other side, and then maybe we can try and answer those first three.
Thank you very much. I'm Paul-Eric from Accenture. I work a lot with your data. It's amazing. Thank you very much for sharing this database. Really, it's the database that we all use to conclude on the situation today. But lots of people simplify your conclusions, saying that 2 billion people lack access to safe drinking water, which is not what you say. And the main issue is that we consider that safely managed services are the ultimate step for countries, for people, which is not the case. Because in lots of countries, people don't drink the water you have on tap water, and especially vulnerable people. My question is, what part of the population do you think, or do you consider as safely managed services, access to safely managed services, but has not access to safe drinking water?
Okay, 3 very good questions. Let's maybe take those and then we'll move on. So keep your questions. I can speak to China and India, perhaps, and then maybe do you want to talk about innovation and the kits?
Yeah.
So this is a observation that Rick made, that where we don't have data for very large populous countries, it's difficult to get an estimate for that region and also for the world. China and India are the most obvious examples, but there are many others as well. So we do try to focus our efforts on working with those countries to firstly adopt the standards and to collect the data, but also to compile those data and make them available and accessible so that they can be used at the national level, but also ultimately for global monitoring. So we do tend to focus a lot of our support in large countries, including China and India. And we have seen improvements in the data over time. The really big challenge with very large countries is simply compiling the data in a standardized format. But there is another challenge, which is actually putting it in the public domain. And so we are constrained in that we can only use official data sources. And if they are not published or made available to us, then of course we can't include them in the global databases. So that's also something that we have to continue working on to try and encourage open data. So I think that's all I want to say on China and India. But do you want to pick up the question on innovation, Rick, and any reflections on what proportion of the population has safely managed but not safe drinking water?
Yeah, let me just add on the India-China question that in many countries, there are different actors responsible for water and sanitation services in urban and rural settings. And in India, in particular, there's been huge national flagship programs around rural areas. And the data available through Swachh Bharat mission, through the Jal Jeevan mission, are just different from the data that are available in urban settings. And we've been able to use water quality data coming from the Jal Jeevan mission's work. So we're hoping that that will extend into urban areas as well. On the question of innovations, well, Tom mentioned that we're constrained to using official sources that are recognized by the government. So it's that might limit the potential for things like remote sensing or crowdsourcing, kind of novel ways to collect data, because there could be valid questions about the representativeness, about the quality of data collected. So I think if the national statistical system had helped generate those data, we'd be happy to work with them. There are also examples where there are geostatistical models, for instance, to predict on the basis of geology or other remote sensing or geostatistical layers where you might find arsenic or fluoride or even fecal contamination. We wouldn't use those predictive models as a factor for safely managed drinking water, but those could be useful to target more precise actual testing to confirm or disprove those predictions. I think there have been technical innovations, though, on the monitoring side, just even simple things like transferring from paper to digital data collection. That's been a kind of unnoticed major shift that's happened in household surveys and other data collection programs in the past 10 years. So that makes data quality a lot better. It also makes certain types of analyses a lot easier. Also rapid assessments, like it becomes a lot easier to identify if you have maybe 20 teams out collecting data and one of the teams is getting data that look very different from other teams. Maybe they have interpreted things incorrectly or differently and they need an intervention, and now that intervention can be made before all the data is collected instead of afterwards. And then also on the technical side for the water quality testing equipment that we use. Tom mentioned that metal manifold is really expensive. We're working to get a low-cost plastic version, which would cost, $5,000 to $10 instead of $1,500 for the steel one. So that is an example where innovation could increase the efficiency of data collection. About the question from Accenture about how many people actually are using safely managed drinking water services. I mean, I think one thing to note is that the JMP doesn't use data on theoretical access or coverage. Sometimes ministries, governments have numbers about how many water points have been installed and then calculate how many people have access to those water points. We don't use that. We use data coming more from populations where people say what type of water supply they use. And then we can match that with data coming from administrative sources. So for instance, if 60% of the population in a country says that they use piped water, then we could look at data from the water regulator that says half of piped water is free from contamination and combine those in that way. So I don't think there's a big risk of using theoretical coverage instead of actual use. But as I mentioned, we can't combine those different factors at the household level. So this taking the minimum of the three approach, that does lead to underestimating the number of people who actually are missing all three of those things together. So we've done some modeling exercises to see how many people probably have access to all three of those factors at the household level, and it does tend to be significantly lower than with the approach that we're able to do. I don't know if that answers your question or not.
Did you want to come in on this?
Yeah, one thing on innovation, actually. I just want to mention, yes, Rick covered everything, but we are keeping our eyes open because we are always working with some researchers. We are involved in some papers, ongoing studies using geospatial data, machine learning. We just work with EVAC, for instance, on a paper. So we keep our eyes open. Just want to say we are involved in it, but just watching it, let's say, for now.
Good. So let's keep going with the questions. And Rick, if you could also check to see if there are any questions coming in online. Yeah, so we had 3 on this side, I think, at least. Yeah, please just go ahead with the next row if we could, so we don't miss anybody. And please tell us your name and your organization.
My name is Muluna from World Resource Institute, Addis Ababa, Ethiopia. I just, one of my doubt was about data quality and inconsistency, especially in countries who have a weak monitoring system. Because there may have less trust from information from the government officials, office, even the reporting system is inconsistent and not trusted unless in some case where there is a big program, like for example the JMP program funded from the Finnish government. They have a good monitoring system, though we can't trust reports like that. Otherwise, a report from the government from the lower level to the higher level is less trusted, in my understanding. And also how you consider the non-functionality rate of water supply schemes. Usually, for example, in Ethiopia, condition like 20 and above % of the schemes are the non-functionality rate of the schemes are above 20%. So how that will be incorporated in your data analysis when you count yearly? Thank you.
Thank you.
And I'm from India. There are 3 questions for me here. What is the frequency of sampling at the different levels annually? Whether the data entered manually at the field level by the field technicians or rather, how you're validating the data it's correct or not? These 3 questions. And one more answer to my colleague who asked India's data, because we are working on the Jal Jeevan mission. There are 909 million population is there, 6 lakhs, that is 0.6 million villages are there. So now we started around 23 lakhs people have been involved in taking the data at the village level. So the data is coming up. You can see in the dashboard how this is there. And fourth question to the panel, which I want to tell you. Up to 2030, GMP can do the systems like providing a fund for the costliest field test kit. But it won't continue forever. How that can be done it by the community? That's a very big question. Thank you.
Lots of questions, lots of good questions. We'll take one more. Yeah, as long as you're keeping track of the rows. Go ahead, please go ahead.
Okay, not sure it's on, okay. My name is Stephen, I'm from Nazava Water Filters. And first I have a feedback and comment. Those interactive sessions that we did today were very useful. I think it would be great if you could have some like tutorials or some videos online for the general public to use as well. That would be very nice. And my question is pretty simple, related to the first question of the day. So you're missing China and India, and I can see many other major countries. So how exactly do you come up with this 2 billion people lacking access to safe drinking water figure that we all hear? Where does that come from then?
Great question. Okay. Let's take that round of three. Rick, are there any online that we should add?
We have something online that's more, yeah, we do, actually. We have a couple. Let me just narrate them. One from Jagannatha Venkataramia is more of a comment, I think, saying that non-compliance to water quality is a reality in India. The government has banned abuse of RO UV water units, but private interests are superpowers. Okay. Also suggesting that there's some papers from journals on water quality management for validation of official data. So maybe we could speak a little bit about how academic journal articles could or could not be used for the SDG reporting. And then we have a question from Rafaela Betts, who got both rounds of exercises correct, who asks that quality data is obtained infrequently, and given the variability in water quality, such as seasonal changes, how confident are we in the reliability of these results? So those are excellent questions. Thanks.
Yeah. So Rick, maybe you could start with a question from Ethiopia on the reliability of national monitoring systems and how we decide which data to include or not, and the non-functionality. I'll speak to the India question, and maybe actually you could talk about how we produce the regional and global estimates.
Sure. So again, for data quality, first of all, the ultimate arbitrator of SDG statistics in a country is the National Statistics Office and Authority. So in every case, they're the ones who have the final word and say, should some data sources be used or not to make estimations. And we follow a process of country consultation. So we actively seek out new reports that have been published from ministries, from academic sources, from surveys. We compile them and create draft estimates and send them to countries for a consultation that includes the statistics office. And in some cases, the statistics office says, this data source should not be used. We don't consider it reliable or a national source. Please remove that, and we do that. In some cases, they say, there's this other data source that you haven't included. Please include that, and we'll do that. So in the end, it's the national authorities, and especially the statistics office, that has the final voice. But to your point about infrastructure and weak monitoring systems, that's again how we balance data coming directly from populations, like through censuses or household surveys, with data coming from administrative sources such as ministries or regulators. And we give preference to data coming from populations when the question is, what types of services are people using? It's the households themselves who say, I'm using a well. It's not the ministry list of how many wells there are that we draw upon. And that, in a sense, answers the question about non-functionality, because non-functionality doesn't enter into our data systems, because presumably a household is not going to say, I use a well when that well is non-functional. So it's an important question, it's an important source of data, but it doesn't enter into the SDG statistics. Yeah, I think I'll stop there.
Great, thanks, Rick. And questions then from India. The frequency of sampling. So this is different in each country. So we have, I think we talked about Brazil, where we have a very large number of data points, and this is data that is collected routinely every quarter for the vast majority of the population of Brazil. And then we have other countries where we have maybe 3 or 4 surveys which are separated by 3 or 4 years. And so there's different frequency of sampling, but also frequency of data points with which we make these estimates. And we recognize that, and we draw attention to that. So that's very important. For the household surveys themselves, they tend to happen on a frequency of sort of 3 to 5 years. But there may be different surveys. So there may be socioeconomic surveys, there may be income and expenditure surveys. There are lots of opportunities to increase the frequency. And in almost all of the surveys that we support now, the data are entered into a CAPI system, and as Rick mentioned before, that brings in lots of opportunities to do field checks and to verify and validate the quality of the data that's being inputted. But this is inputted by enumerators who are trained in data collection and reporting. We don't have any additional validation of the test results. So what normally happens when we integrate water quality testing into a household survey is that we will involve the national laboratory, and we will involve the regulator and the ministry in the training so that they can observe the protocols, they can be comfortable with the protocols, and that they meet national standards. And then, of course, during the process of water quality testing, we have these field checks, such as the blank tests, which will pick up any problems in the field. I think one of the very interesting things about JLJaveen is it's combining data reported by communities with data that's been validated in labs. And eventually, when the data are available for a larger area of the population, we'll be able to compare the two. And it'd be very interesting to see how reliable is data collected by communities. Is it good enough? Big question. But in the meantime, we do rely on official data, and that tends to be collected by the Bureau of Statistics, by the ministry, by the laboratory. And you're absolutely right. By 2030, it is essential, really, that all countries are available to routinely collect information on drinking water quality without the need for external support. That is certainly the vision. And in order to make that possible, the costs of doing this need to come down. But of course, as the demand for water quality testing increases, then of course the costs will come down as these technologies are used more widely. So I think that will happen. It's just a question of by when. But Aicha, very important question. How do we come up with estimates when we have limited data coverage?
Before that, I want to acknowledge the other comment that you shared, like manuals, guidelines, videos. We totally highly agree on that, and we are actually, first of all, we are now working on a presentation, let's say, page on our website. We already started to insert these things, and hopefully it will be available soon, including these slides and videos as well. But that's a very valid and useful comment. Thanks for that. And coming back to the aggregations, I mean, for sure, I think we showed, we talked about it a bit here when we were talking about Oceania, Australia. Definitely the overall population coverage is important. If we are not above a threshold, we are not producing those results at a regional level. And one example was for, again, here Oceania not having Papua New Guinea, or in Australia, New Zealand not having the data for Australia. What we do for aggregates, we impute data at country level. These are not shared. These are all for the regional and global estimates, but we impute data based on the M49 regional groupings by using that. Actually, most of the SDGs, I work with other SDGs as well. They're applying similar rules, but imputation is there always. So we impute data at country level using regional numbers, but again, being careful about the coverage, if it is hitting that special threshold there or not. And yeah, we put those numbers as well like that. I mean, at global and at regional level. And I want to also mention, we have country files available, but we also have regional snapshots available where we disaggregate this information in a similar way like we have in the country files. I would be so happy to hear back if you will be interested on that. I want to make an advertisement here as well on that. Thank you.
Great. And just to say, it's not true that we don't have any data for India or China. We don't have national estimates. So we have data for rural India and for urban China. So we do have quite a lot of data, but it's just not sufficient to make national estimates. So let's try and do one more round of questions and see if we can catch these last few questions, and then I'm going to pass to Bruce to wrap it up. So could you help us with this row on this side first? Thank you.
Yes, hello and welcome. My name is Zaidan. I'm working with UNICEF in the state of Palestine. My question is related to the water quality, particularly the priority chemicals, because what was mentioned in the GMP is only the testing for arsenic and fluoride. But recently, because there is a tendency now in the people to go for the seawater desalination, and we have already established with UNICEF the largest one in Palestine to provide water to 250,000 people. The problem there is the boron. And boron, according to the WHO, it shouldn't exceed 2.5 milligram per liter. So my question, why the GMB focuses on the arsenic and fluoride, but not on other minerals that has a negative impact on the public health? And thank you.
Very clear. Thank you.
Hi, my name is Mian, and I'm from ETH Zurich, and we are actually working on a project called Open Wash Data, and because I'm a data scientist, my questions would be more on the data side. So this massive, amazing data collection is great. It makes the data very available, but I want to ask for your vision or plan for reproducibility, because currently it's still like a database for people to download, and we cannot see other people's work or analytics on your data set. And also, if this project is ended, how do you think to make the data more reproducible in this sense?
Great, thank you. Let's keep going. Try and capture a few more. So maybe the next row on this side, and then we have two on this side. Yeah.
Thank you very much for the presentation. My name is Jessica. I'm from Ricardo in Australia. My question, impressed that Australia is not there. I can't believe that there is no national level, and that's definitely one of my insights, but hopefully you can get it at some point. Do you go back to the countries with those three factors in accessibility, water quality, and I forgot the other one, to go back and tell them, look, I mean, you're saying that you are almost 100% in improved water, but you're very behind in accessibility. Do you have some sort of way to go back to the countries and say, this is where you have to focus? Because or it depends on them reading the report. And also, really shortly, you mentioned that the whole team was here. How many people work on this? This is just amazing. I want to know a number of how many people are included in this type of work. Thank you.
Thank you. Two more questions.
With respect to GMP, thank you. My name is Bilal. I'm from Australian Government's Department of Foreign Affairs and Trade. So my question is, in terms of the country files, GMP, and not only just looking at GMP, but the other data sets like GLASS. So if we want to look at any country profile that, okay, what is the coverage there in terms of drinking water, sanitation, or hygiene, then the subsequent thinking would be around those policies or on the governance structures or on the financing mechanisms. Is it possible to combine two different data sets from GMP and from GLASS, which is another source of great information within WHO? The second point, I just want to highlight on the validation point that you mentioned earlier. In fact, in my career, I remember we used when we were developing the water quality data. Normally, it's part of the mixed multiple indicator cluster survey, and within those surveys, there is a provision to have a certain, let's say 5%, 2% or whatever. So, you can say what you call I mean, the data points will be validated. That okay, those households need to be validated. So that's within the system of mix that they have to do that. So that's on that. Then the third point is on Australia point again. I think I don't know if it is possible that you use the data at the provincial level or at the state level to come up with the national figures, or you specifically need at the national level, because ultimately, I mean, in many countries, the water sanitation data, it's under the state government sort of responsibilities. So is there a mechanism where you gather that data? Otherwise, it look like that the people living in Australia, they're not having a safe drinking water, which is not the case. I work with the Department of Health of one of the states, and they have very stringent standards on drinking water quality. So it's just a matter of representation, that how we need to represent that. Thank you.
One last question, and then we'll wrap it up.
With CEDA, the Swedish International Development Cooperation Agency. In my previous research, much of it in India, household surveys there, one thing that has always bugged me a little bit is that most of the household surveys, they ask for the main source of drinking water. But working in the field, we know that most households need to have backup services, so a secondary, tertiary source. And very many households alternate between those. They know where to get the water if the pipe isn't functioning. And I mean, India, you get water once every 2 weeks in some cases. So are you aware of some countries' household services that actually catch secondary, tertiary sources as well? And do you take any such into consideration?
Great. Thank you very much. Excellent questions. Okay. So we don't have much time. So Rick, can you take State of Palestine and secondary sources, maybe, quickly? Aicha, if you could take reproducibility, open data, yeah, and I'll take the other two.
So super quickly on chemicals, WHO has over 100 guideline values for chemicals, both inorganic chemicals and organic chemicals. And it's just not feasible at a global scale to try and track them all in a database. So what we've done is select the chemical parameters that have the most grievous health problems and that affect the largest numbers of people. And both arsenic and fluoride have horrible health impacts and affect hundreds of millions of people around the world. So that's why we've focused on those two. Of course, countries, you know, at the national level, different parameters may be prioritized, and there's nothing wrong with that. So it's just a limitation of what we can do at a global level. And then the issue about secondary sources, it relates a little bit to the earlier question about seasonality of water quality. What we would really like to have is data from an oversight authority, like a regulator, that covers the entire national population and can tell us, you know, what water quality is like longitudinally, not in a snapshot. Likewise, what the different types of water supplies that people use are. I think just from a data collection point of view, it gets very messy if you try and put into a database primary, secondary, tertiary ones, and then get drinking water quality for the different ones. So I think it's just more a limitation of our methods that to keep things simple. And we still, you know, we struggle to get data even for the one source. I think it would be an interesting research study, though, to drill into and see how big the differences would be if you include secondary sources.
So I can take the open data one, but since I said this is the whole team, I made a mistake. For sure, 3 of the main characters are here, but we have 2 more, definitely even 3 more people working. But I agree, it's a lot of work for even 6 people. So thanks a lot for raising that. Since I made that mistake, I want to correct that. Coming back to the open data part, I mean, you were right. And when you check those country files, Excel files always sounding they're terrible, right? For people like data people like us, because we want to see them in a, you know, long file, whatever file, but these are not definitely. But we have those files already embedded in our system. I mean, we have the data, all main indicators, not at country level. Country files has, as I explained, line by line we share, I think, too many details. But we have in the files that shown a bit the main sub-indicators building up the WASH, the SDG indicators. And we are working with other people again, for instance, GitHub, our API, we are working on those things as well in parallel. But yeah, we are on the way, let's say. Let me put it this way.
And just to follow up on that, our vision is to share not only the data in an accessible way, but even the scripts that are used to extract data from individual sources, or to combine them to produce country estimates, or to combine country estimates to produce regional and global estimates. But they're long and messy at this stage, so we need to tidy them up before we can make them publicly available.
And analytical as well. I mean, we are using Stata mainly. We are trying to find also ways to develop R-level codes for analysis as well to share, not only the region estimates. For instance, for the figures, we generated all those codes for generating whatever, if you have the standard form of that data to generate that figure, we have some already well-defined do files, basically. We want to share all of them, having a GitHub library. That's the plan.
Thanks. Okay, so just those last two then. So building on this question in Australia, okay, we don't have the data. What we do is we have a process of country consultation before we publish estimates. So this is a 2-month period of consultation with national authorities. We have some draft estimates. We want technical feedback on those estimates. We ask, have we got all of the latest available data? Have we interpreted it correctly? Is there anything missing or anything that should be taken out? So that is our opportunity to sort of raise questions, hold up a mirror, say, is this really the situation in your country? And the quality of those country consultations varies enormously depending on the players. And so it's really helpful for us if other stakeholders can get involved and be part of that conversation, and to really ensure that there is a response to big data gaps, and that governments are acting on the data that's being published. And then you're absolutely right. Mix and many other surveys have a lot of built-in data checks, quality checks. All of those apply to anything you put in the survey, including water quality testing. So that's a really important point. Sharing scripts is easy for standardized data, but standardized data makes up about 20% of our global database. The rest is completely non-standardized, needs a huge amount of cleaning to make it usable. And so that's the example of the countries that have only state-level data. If it hasn't been aggregated, in some cases we can aggregate it ourselves and come up with a number, and if we're satisfied that it's covering at least 80% of the rural population and 80% of the urban population, we might publish an estimate with a note. But in many cases, it's much lower than that, and so it's not really possible. So we would much prefer if federal, national governments compile the data and come up with the numbers. But really good point about JMP and GLAS, and Bruce, you might want to reflect on that. But that's something that we need to work on. The cycles of reporting for JMP and GLAS are a little bit different, but ultimately that's the vision, is to bring them together and understand the linkages between the two. I really hope we've at least partially answered your questions. If not, please do email us or grab us during the rest of the week if you'd like to discuss further. But for now, I think I'm going to pass over to Bruce to wrap up the session.
Just be 30 seconds, because I know you're all going to lunch, but I just wanted to thank all of you for really kind of challenging the joint monitoring program. I think you all have high expectations. And I hope that you'll see that there has been like a tremendous amount of progress that we've made since the kind of improved, non-improved days. Whenever we have a JMP session, I'm always a little bit like kind of excited and sort of feeling a bit anxious, because the questions that you ask are always very technical. There's also with passion, what are we really capturing safe, all these things. And we're trying our best. And, on the WHO side, I've worked a lot in my life on the guidelines for drinking water quality, and it's important to remember this is monitoring. It's kind of a separate issue, and I know it's come so far that we kind of think of it almost as norms, like is this the criteria for safe? And it isn't. The criteria for safe is in our guidelines, and it's 600 or 500 pages long. But this is the best that we can be doing right now to really try to capture safely managed services, and there's a long way to go. And we've been challenged. We're now challenged on monitoring climate resilient services. That's going to be one of the best, the other things, and gender, which we will talk about. So the last point, and thanks for mentioning it, was the size of the team. I mean, we're obviously benefiting from all these data sets around the world, but the best that we can do with countries is really to encourage them to use comparable definitions and to do the surveys themselves. In some instances, we're doing the household surveys, training the enumerators, but at the end of the day, this transition to country ownership has to be made, and we're hoping that our team of 5 or 6 can help along the way. Thanks to our supporters, some of whom are in the room, and again, the door is open for all your questions and comments, which will always be, it'll be a pleasure for us to talk and answer those. So have a great Stockholm week, and enjoy your lunch. Thanks.